Hi, my name is Jared Carter. I'm a physical therapist, and I'm going to be showing you a self-release for the psoas muscle, which is one of our primary hip flexors. It runs from the front of the hip to the front of the lumbar spine and is very involved in a lot of different back pain issues. This is just a video for Carter Physiotherapy patients. I wouldn't just tell anyone who've not seen us and had this directly prescribed to be pushing into the guts and into the stomach in this way. So if I've given you this exercise, or if we've given you this exercise, this is how it goes. Essentially, this is a pressure inhibition style of technique where you're pressing and holding on the psoas until it relaxes. And you're going to do that in a relaxed state, i.e. laying on your stomach. So what you're going to do is you find your belly button and then the front point of the hip bone, the kind of most pointy part of your pelvic bone, and you imagine there's a line between the two. You want the ball to be right on the middle of that line, not too low, especially if you're a woman. You go a little too low, you're going to be pushing on your ovaries. So think about the line, the belly button to the front point of the pelvis, right there. Place the ball and then ease down into it. Now if that hurts right away, you're just going to breathe into it. You might have a pillow underneath the chest and something underneath the ankles, so you can really just relax and breathe into it until the pain subsides. Now if the pain never really subsides, then that's all you really need to do. But let's say you start to do this over time, and it's not as painful anymore. Then you're going to start to use some leg movements in order to further release and really get into the psoas. So first, you're going to do knee bends up and down. Do about 10 of those. Then you're going to be dropping the foot in and out, again about 10 times. And then finally, you're going to put your toes down on the ground and extend the knees straight. Now this is not something you typically do on a bed because usually it's going to sink in too much. If you only have a bed to work on and you don't want to do it on the ground, or it's a problem to get down on the ground and back up, you can use a thin book underneath the ball so that it has something firm to push against. So those are the main movements that you would add. So you're doing after the knee extension, and if you need further depth of push on the ball, you can frog leg out, kind of kick out the other opposite side, out to the side like that, and then go through those same movements, 10 repetitions of each.